As a recovery coach, I come into the hospital and meet with patients who are struggling with substance use issues. I'm in recovery myself, and I have a very large and deep compassion for this population, for people who are still struggling with addiction. When I go in and meet with patients, they're often feeling really, really horrible. They might be feeling really, really sick, or they might also just be feeling really depressed and shameful. And so I like to go in there and just meet a patient where they're at. Just sit with them and hold space for their discomfort, for their sadness, for their own grief, for their own misery. If a person is here for a RAM request, which is rapid access to medication assisted treatment, the nurses and the doctors will draw blood, take a urine analysis, and decide if they're a good fit, in addition to asking some questions about their withdrawal symptoms or their current usage and what drugs. I'm here with them the whole time, going through the process with them, just being a support and listening to their concerns, and sometimes meeting the doctors and discussing the patient's concerns with the doctors or the nurses, depending on the patient's comfort level. I really love this job because it helps deepen my own recovery. It helps me to remember what it's like for those who are still suffering with addiction. And I'm constantly learning new things, new recovery tricks, and I've already learned a lot with my own experience, so I appreciate being able to share that with others. When folks see that, there is a face on the other side of addiction and in recovery, I'm hopeful that that will give them the courage to take the steps to move forward in their own life, in their own journey of recovery.